a fantastic week. My week has been incredible. It's been the first week that Phoebe and I have got to be in the same location, chasing our dreams together in about 8 months or so. And it's just been so encouraging and so inspiring. She had an absolutely amazing first day. She was able to do so much, see so many patients. She's doing OBGYN right now, which is what she kind of wants to do, and she's just loved her week so far, and that just makes me so happy. So right now I'm headed to the hospital. It's about 4:50. I had to go in and work out at 3:30 this morning because I'm on call tonight, so I have 24-hour on call tonight, so I won't get a workout later. So I had to wake up early, go get it in, and now I'm headed to the hospital. Alright everyone, well, I'll shoot some videos today, tonight of what goes on during my on-call. I hope you guys have a great day. Let me know what you guys have been up to, how you're doing, if there's anything I could be praying about. Remember, I am here for you guys. So if there's anything you guys need, any prayer whatsoever, please let me know and I'd love to help out. Alright, I love you guys and have an incredible day. And remember, love endlessly with relentless passion. What's your favorite part about morning rounds?
Morning rounds, waking up the patients. It's kind of interesting. You're the first thing they see in the morning, so usually you brighten their day, know that someone cares about them.
Alright guys, so this is Angela. She's a third-year medical student, and she's going to be telling you about her favorite specialty rotation so far.
Okay, so my favorite specialty rotation would be ortho. I had ortho a couple weeks ago. My experience with it right from the beginning, they're more hands-on. They let you jump in there and just touch things. I mean, like for a medical student, just holding holding the retractor, holding the leg, it's something, because sometimes you're in the OR and just watching and not doing anything. So I really enjoyed ortho. I was able to do total knee replacements and hip and rotator cuff repair and a whole bunch of other really cool things.
Wow, it sounds like you had a great experience.
I had a blast.
Thank you, Angela.
You're welcome.
My name is Carlos Romano, and I'm here to talk to you about the neurosurgery subspecialty. It's been an awesome experience. We were able to see some craniotomies, some brain biopsies, and a lot of herniated disc repairs, which was really cool. I, suffering from one of these, can see how they go in and fix these and see a couple days and weeks and how these people feel so much better. It's been an amazing experience just to sit there and see how careful, meticulous these surgeons are working with something so delicate as the brain stem and the spine.
Hi, I'm Deepthi. So I had my subspecialties a few weeks ago, and one of my favorite subspecialties was urology. I had the opportunity to work with a patient who had renal cell carcinoma, and they did a robotic nephrectomy. So it was the first time I have actually seen through the Da Vinci machine. So to see things on the 3D dimension, looking through as if you're actually inside the cavity, that was amazing. And I thought, it was such a unique experience, and the surgeon was kind enough for me to also watch while he was doing it through the Da Vinci machine. So that made the experience even more enjoyable than just watching it from outside on the screen.
Perfect. Alright guys, so this is Deepthi, and she's one of the kindest people I've ever met. She's absolutely incredible.
Blah, blah. Alright, I'm ready.
Alright Rip, so tell me one of your favorite things that you've seen at the hospital so far.
One of my favorite things definitely has to be yesterday, actually, when I was following one of the doctors here, and we were rounding on some different patients, and we came to a patient who has some ulceration and osteomyelitis in one of his feet, and he had a plate of food in front of him, and he wasn't moving, he wasn't talking, and he didn't seem too happy. And so the doctor looks at me and says, "I'm willing to bet you anything that this man right here is really hungry." And I look at my resident, and I was a little confused. I said, "Okay, how could you know that?" And he starts talking to the man in another language, and then he starts feeding the patient. And he looks at me and he says, "See, this patient can't really move his arms too well." But nobody bothered to ask him that. Everyone thought that because he wasn't eating, it was just because he wasn't hungry or he didn't like the food. But in reality, this man wasn't able to get a spoonful of food and put it in his own mouth. So he was sitting there hungry for a couple of days. And the attending began to feed him and continued to do so for the next 30 minutes. And he looked at me and he said, you know, if you do something like this for your patients, God will repay you. And for me, you know, it was just the epitome of what a doctor should be, is to connect with someone on a human level, to provide with them what they need when they need it most, and, you know, to just give the time and company, and to just be there for that person. He cleaned up his face, he wiped the food, and just talked with the man, and, you know, made him smile a little bit. And the guy was so gracious, and he had so much gratitude afterwards. And I think that really made a difference, and that definitely has to be one of my favorite things that I've seen in the hospital so far.
Amen. Well, Rip, one of my favorite sayings is that we should approach everything with endless love and with a relentless passion. Looks like that's what that doctor did, and we should do the same.
Yep.
Alright guys, so now just some general advice about specialty rotations. So first and foremost, go into it with an open mind. Don't have a preset disposition to a certain specialty that you want. Go into each of these and act as if it's going to be the specialty you're going to be in the future, so that you give it everything you have. Another thing is, for each of the specialties, make sure you do something special to that specialty. So for ortho, do a knee replacement, do an ACL reconstruction, do a shoulder replacement. Make sure to intubate someone during anesthesiology. So make sure to do all the special things associated with each specialty. And lastly, even if it's a specialty that you really think that you do not want to do, again, go into it with an open mind and give it everything you have. The specialty doctor for each of these specialties should be able to go back to your attending and tell them that you came to work every single day, jacked out of your face, ready to practice, just so excited to be there, and was just wanting to learn so much. And above all, that you loved your patients endlessly. Alright guys, I hope you enjoyed the video. I love you. Have a great week.